Autism. Autism spectrum disorders. Clinical psychologist Dr. Dilarom Demirolay. Remember the feelings of childhood, when you lie down and cannot fall asleep from the inviting moon that shines, sparkles outside the window. You look at it and dream. You dream about a new toy, about a big sweet candy, about going to the circus, about how to tie your shoelaces yourself or keep your hat on your eyes when you skate. And most of all, you want adults to understand you, to hear what you are thinking, to talk to you in a language that you understand. There is probably not a single child on Earth who does not dream, looking at the moon or into himself, of understanding. How important it is to be understood and help to understand this complex adult world, with its can't instead of, want, must instead of, don't want. It's like a child on one side of the moon and an adult on the other. And if the child is special? If her world is even more different from our usual one? If he sees things differently even among children? How can he find his way to the other side of the moon? How to adapt to society? How can we help him or her? First of all, remember that feeling from childhood, when more than anything in the world I wanted to be understood. You can learn to hear, understand and help special children. There are simple steps to do this. Step 1, theoretical knowledge. Step 2, diagnosis, acquisition of skills in drawing up a portrait of an autistic child. Step 3, mastering the methods and techniques of working with special children. Autism is a feature of a person's mental development. The essence of autism. Notes: autism, from the Greek autos, self, is a separation from reality, isolation from the surrounding world. That is, the autistic child is like himself. He is fenced off from the outside world by a wall, disconnected from reality and cannot adequately respond to it. Hence, speech disorders, motor skills, and stereotypical activities and behaviors that lead such children to social maladjustment. This is a developmental disorder. A defect in the system responsible for the perception of external stimuli causes the child to react sharply to some phenomena of the external world and almost not notice others. A disorder that includes more than one dysfunction, as, for example, in a specific metabolic disorder. The concept of autism is a complex disorder, to a greater extent than epilepsy and mental retardation. Autism is a symptomatic manifestation of brain dysfunction, which can be caused by various lesions. First, extreme loneliness of the child, violation of his emotional connection even with the closest people. Secondly, extreme stereotyping in behavior, manifested as conservatism in relations with the world, fear of changes in it, and as an abundance of the same type of affective actions, drives of interests. Thirdly, a special speech and intellectual underdevelopment, not associated, as a rule, with the primary insufficiency of these functions. A special, extremely characteristic type of mental dysyntogenesis. Today, 6.5 million autistic people are officially registered in the world. Only in the last 30 years, the statistics of this disease have increased dramatically. According to the World Autism Organization, in 2019, one case of autism per 150 children. In 10 years, the number of children with autism has increased tenfold. Autism is called a disease of the 21st century. All over the world, the problem of autism is already widely discussed and successfully solved, and in Middle East, unfortunately, there is practically no information about this disease. Although every year the number of children with autism increases exponentially. Pediatricians are very poorly informed about this disease. It takes years before a correct diagnosis is made and treatment begins. Children in our country undergo the first examination by a psychiatrist only at the age of 3 and only with the consent of their parents, and the first signs of autism are visible much earlier. Autistic children of RAIN. Mostly, autistic people are boys. In girls, autism is rare, 5 to 7 cases per 100 people. Autism, disease or genius? Most autistic people are talented and gifted. In the people, this disease is often called the disease of geniuses, although in fairness it is worth noting that each individual autistic level of intelligence can be from the minimum to the highest. The proof of this is the world-famous stars. By the way, in the developed countries, a family with a child diagnosed with autism receives from companies $10,000 a year for correctional treatment. And almost 45% of IT departments' top programmers are autistic. Many prominent individuals suffered from various forms of autism. Among them are Albert Einstein, Isaac Newton, George Orwell, H. G. Wells, Mozart, Kant, Socrates, Darwin, Lewis Carroll, Leonardo da Vinci, Vincent van Gogh, Michelangelo, Picasso, Yeats and other great people. Causes of the occurrence and development of autism. Innate biological factors, such as brain dysfunction, underdevelopment of certain lobes of the brain in combination with hyperdevelopment of other areas of the brain, chromosomal abnormalities and metabolic disorders. Some assumptions about the causes of autism. Disorders of the development of the amygdala. Changes in the mini-columns, structural and functional units of the brain. Enhanced brain growth in childhood. Rainy weather. External manifestations of childhood autism syndrome. Extreme loneliness of the child, difficulties in establishing eye contact, stereotypical behavior, preoccupation with monotonous actions, addiction to the same subjects, a special characteristic delay and violation of speech development, early manifestation of these disorders. Characteristic stereotypies, involuntary, unconscious repetitive movements or actions. Motor skills, speech, spatial data, social networks, gaming. Types of autism. Autism in various diseases of the central nervous system. Psychogenic autism, autism of schizophrenic etiology, autism in metabolic diseases, autism in chromosomal pathology. RDA groups. The most severe form of autism. Characteristic features: there is no emotional contact with adults, the reaction to external stimuli is weak, mutism may be present, a typical facial mask of deep rest, typical field behavior, aimless movement around the room, avoiding strong stimuli that cause fear, noise, bright light, touch, etc. Group 2. Characteristic signs. There is a reaction to unpleasant physical sensations, pain, cold, hunger. In speech, the same type of clichés commands prevail. It is possible to fulfill the requests of the mother, excessive attachment to the mother, the combination of emotional coldness to others with increased sensitivity to the state of the mother, stereotypical actions aimed at stimulating the senses, rustling paper, rotating objects in front of the eyes, etc., stimulating the vestibular apparatus by swinging, bouncing, etc., ritualization of everyday life. Group 3. Characteristic features: the presence of speech in the form of an emotionally rich monologue, the ability to express your needs through speech, conflict resolution, preoccupation with the same activity, a large vocabulary of bookish character, a paradoxical combination of anxiety and fearfulness with the need to relive traumatic experiences. Group 4. Characteristic features: ability to communicate, intelligent functions are preserved, excessive need for protection and emotional support from the mother, the presence of ritual behaviors, the social circle is limited to close adults, difficulties in mastering motor skills. What should be distinguished from childhood autism? Deafness, blindness, mental retardation. Motor and sensory alalia, absence of speech with normal, hearing and mental development, motor alalia, inability to speak, sensory lack of understanding of speech. Schizophrenia, communication disorders. Features of deviations in speech development. Mutism, complete or partial absence of speech, echolalia, speech cliches, speech stereotypies, no use of the first-person pronoun, speech development that is ahead of the dynamics of the motor sphere, phrase up to 3 years old, the predominance of monologue speech and auto-dialogues. Having known misery, I learned to help the sufferers. Marin Publius Virgil. Don't scare off a miracle. Working with autistic children is a miracle. Every day you discover the world anew with them, you look at many things differently. Every day you build bridges and pave roads to meet the child, you become clear to him and take him by the hand, bringing him into our world. Constantly walking on tiptoe, trying not to scare off this miracle of his entry. You need to believe, in the child, in yourself, in your parents, and at times to be amazed, horrified and tremble when suddenly a miracle happens. Someone is doing this miracle. Faith is walking on tiptoe, faith fills you with love, kindness, and patience. Methods of organizing correctional care. Creating an adequately organized environment. Using the child's autostimulation. Stimulation of speech development. Tasks of corrective action. The departure of an autistic child from primitive, monotonous activities and the formation of directed activities, transition from passive to conscious mastery of regime moments, skills, gradual transition from individual to group classes. Correction tasks. Expanding your vocabulary, developing the ability to make suggestions for pictures, series of pictures, work on a coherent text, consisting of conversations, retelling, playing, dramatization of various topics, reproduction of poetic speech. Methods of corrective action in autism. Stage 1. Working out the most important response of animation and tracking, the formation of the visual motor complex, when in the process of manipulating objects, tactile, visual tactile, kinesthetic, and muscular perception develop. Stage 2. Transition from a manipulative game to a story game. The main task, the motivation for activity, the repeated repetition of games, the formation of game stamps with the constant use of the visual motor complex. Stage 3. The introduction of more complex games and the motor activity itself. Verbal comments should be given in a short form, specifically, consistently, repeatedly. Special children, a special view of the world. The pictures that you will see are drawn by children of different ages, character and temperament. They are united by one thing, autism, the inability to communicate, isolation from the outside world, self-absorption. The creativity of these children can be attributed to outsider art, the art of outsiders. None of them specifically learn to draw and does not consider themselves an artist. Their paintings do not so much depict the outside world as reflect the inner world of their creators, their special perception. They do not know how to draw to order, or on a specific topic set from the outside. Drawing for them is like breathing or moving, and therefore their work is surprisingly sincere and harmonious. Realizing the extreme importance of the problem, the 62nd session of the UN General Assembly in 2008 decided to celebrate World Autism Awareness Day on April 2 each year. On this day, public organizations around the world strive to convey to parents, specialists and authorities the need to raise awareness about autism as a serious disorder of early child development that requires the close attention of the entire world community. Scientists are concerned that the true causes of the disorder are still not clear, the rehabilitation process requires significant efforts, and most importantly, the number of children with autism has increased tenfold worldwide over the past 10 years. The main thing is patience, humanity, hope for the best, faith in success, because we cannot save children from their peculiarities, so we must teach them to live as they are. Teach them to be happy. Thanks for your attention.